Valida says, "Hi, Raphael. I've been enjoying your Ask Me Anything. I've learned a lot from them." Well, I'm glad to hear it. So I'm teaching someone who has damaged C5, C6 and 7. She fell in October 2018 on her right side, but it's her left side that's affected. She has pain in the base of her head that radiates through to the left shoulder, arm, elbow, wrist and hand. The pain is pins and needles and it's constant. They're telling her that if it doesn't get better soon, she'll need surgery, but she wants to avoid it. Is there any good exercise that will help her ease up the pain and help it get better? She can't keep her head up when she lays supine, and that's her goal for now. Thank you. Well, Valida, a few things strike me about this. Now, I've got kind of limited information here, so some of the fair bit of this is going to be guesswork, but I did spend about an hour on Google Scholar looking through systematic reviews and randomised controlled trials on what this is called cervical radiculopathy. Cervical means neck and radiculopathy just means there's some pain or symptom that is related to nerve irritation. So it is the case, like I said a minute ago, that damage or compromise to the nerves at C5, 6, 7 would cause or could cause the symptoms that you describe, pain, pins and needles down the shoulder and the arm. But not the pain up to the head. So right up to the head here, that is C1, C2, C3. C5 is kind of down here. So, and the nerves that come out from C5, 6 and 7, they go down. They go down the body into the shoulder and into the arm. They don't go up the neck. So any kind of problem at C5, 6, 7 wouldn't be expected to cause pain going up the neck into the head. It would be vice versa. If there was pain, if there was a problem with the nerves at the top of the neck, that would cause pain going down the neck, typically. So it seems that to me that's a little bit incongruent, and so the symptoms don't really fit the diagnosis of damage to C5, 6 and 7. They partly do, but not completely. Also, she fell on her right side. It's her left side that's affected. To me, that seems a bit weird unless she fell on her... I can't really imagine how she fell. You don't say whether she landed on her hand or whether she landed on her shoulder or whether she landed on her head or whether she landed on, the back of her head. So I can't quite imagine how she could fall on her right side and that could damage her left side, but might be possible. And the pain is pins and needles and it's constant. So that is consistent with some kind of issue with a nerve root at C5, 6 and 7. A nerve root is just where the nerve comes out of the spine. In fact, I can show you that. So here is the cranium. That's the bottom of his skull. And this is C1 up in here. C2, C3, 4, 5. That's C4. That's C5, C6, and C7. So... and I wanted to show you the nerve roots. And the nerve roots are these little yellow things that you can see sticking out there. So those go out and they go down, they form nerve tracts that go down your arm or shoulder or wherever and bring sensations up to your brain from your arm and hand and send motor commands, commands to the muscles from your brain down to your shoulder and arm. So if there's a problem with the nerve root at C5, 6, 7, it is consistent with the arm symptoms, and the pain in the neck and the head might be a separate symptom. And so I guess that's my first thought is, that diagnosis, based on the limited information that I have, seems a little sketchy to me. So maybe there are other parts to that. And for her to have been diagnosed with, radiculopathy, they would have had to do a full neurological exam. So they would have to test her reflexes and muscle strength and stuff in the arm, her sensation. They poke her with things so if she can feel it, etc. So, and they probably would have to do an MRI or a CT scan of her neck to determine whether the nerves were being pressed on by any structures, a disc or bone spurs or anything like that. All right, so there's that. And then the second part of the question is, what can you do to help her? Well, the prognosis, the natural history of cervical radiculopathy is actually very good. So typically something like 83% of people have significant improvement or resolution of symptoms within 36 months. So that's 3 years. So she's your client is, you said, October 2018. We're now in September 2020, so she's almost at 2 years. So I would say just like steady as she goes, at least for another 13 months with her. There are very limited studies looking at exercise and very few studies looking at comparing exercise or non-surgical interventions to surgical interventions. Typically, the surgical comparisons look at one type of surgery compared to a different type of surgery rather than surgery versus no surgery. However, there was a systematic review, I think it was from about 2010, from memory, that I saw that examined surgery versus, it wasn't a systematic review, it was a randomized controlled trial from about 2010 that looked at surgery versus conservative care. So in other words, physiotherapy and exercise. And what they found was that the people who had surgery for cervical radiculopathy, they had in the short term, their pain and function improved more quickly than the exercise and physiotherapy people, but that by 1 year post-surgery, the exercise and physiotherapy people, their outcomes had caught up, and in the 2 and 3 year follow-up, there were basically no differences between the two groups. So I would say it's not well established, under what conditions surgery is going to give a better outcome. And I would definitely work on strengthening. I would work on neck strengthening. I would work on arm strengthening. I would work on arm range of motion. I would work on neck range of motion. Anything that aggravates her pins and needles, I would tone down. And if it aggravates it momentarily, but then it subsides, just about straight away, don't worry about it. A little teeny bit of aggravation during the session is probably no big deal. But I would try and avoid things that, significantly aggravate her symptoms. And so just neck strengthening stuff. So, if she can't lift her head off the floor in supine, well, there's lots of things you can do. Proper semi-reclining, at a 45-degree angle. And that's that way less load, so she can lift her head against a lighter load, or get her to put one hand behind her head, or get her to get a little flex band. Little flex band behind her head so she can roll up. But the trick is not for her to not just lift her head using her arms, but to just provide some support. So I guess my preference would be reduce the angle to gravity, put her at a 45-degree angle or whatever angle she needs to be at so that she can lift her head without the assistance of her hands. The other thing you can do is, if you've got a longer flex band than this, you can put the flex band around her head and then tie it onto a wardrobe doorknob or a table leg or something, and do neck curls. And then you can put it on the back of her head and do neck extensions, and put it on the side of her head and do neck side bends. So you can work all of the muscles of the neck using a flex band, tied around something secure. So that's my recommendation. I would say steady as she goes, and if she exercises consistently and works on her strength, range of motion in the neck and the arm, and if by October 2021 she's still unhappy with the level of improvement that she's had, that's the point at which, if it was me, that's the point at which I would be contemplating surgery. But bear in mind that there is no clear evidence that surgery is superior. It may well be so for some people, but we don't have yet enough research, I think, to be able to define in advance who's going to do well with surgery and who isn't. So I hope that helps.